Today we'll be discussing a case of a 65-year-old woman who was postmenopausal and was evaluated by her gynecologist for a new lump that she felt in her right breast. And she described that as a grape-sized lump in her right breast that she just recently noticed. Very rightfully, she was evaluated with an ultrasound that confirmed that there was a mass indeed, which was about 2.5 centimeters in size. And following the workup, she then had a core biopsy, which confirmed a high-grade infiltrating ductal carcinoma. And she then underwent a lumpectomy and an axillary node dissection, which revealed a 2.3 centimeter tumor, which was grade 3, driven by the estrogen and the progesterone hormones and negative for HER2, and 4 out of 12 lymph nodes were involved. This woman then underwent a staging CAT scan of the chest, abdomen, and pelvis, which did reveal suspicious lesions in the bone. She therefore underwent a biopsy from the bone that confirmed that this was in fact metastatic from her breast cancer and was also driven by estrogen and progesterone hormones and negative for HER2. So in summary, we're talking about a woman who's just newly diagnosed with de novo metastatic breast cancer to the bone, and it's driven by estrogen and negative for HER2. We've certainly made a lot of progress for patients with metastatic disease. And while we've not been able to cure this disease, we definitely have made some meaningful improvements for these patients due to the new systemic therapies that have now been introduced for treatment of metastatic disease. But there are a few factors that obviously play into the prognosis for these patients, and some of these factors are clinical factors, such as did this patient have de novo metastatic disease, or was this relapse that happened within a few months or a very short time after that initial therapy versus relapse that happened years after that initial therapy. Also, important factors to keep in mind are the estrogen and hormone receptor positivity or HER2 receptor positivity, which might drive into the prognosis for these patients. So the prognosis can vary anytime from a few months to many, many years, and could also be dependent on the sites that are involved.